Hey guys, Dr. Peoples here, and this is a video that talks about the relationship between COVID-19 and healthcare systems and why the two need to be able to work synergistically so that we will not overwhelm our healthcare system with COVID patients and then cause unnecessary deaths. So I hope this video is just as informative to you as it was to me. I'm just trying to compile good content that is helpful for you to understand this process and why this is so important. So watch the video and then we'll talk about it.
In any hospital, the capacity to treat patients is limited by how many beds they have. Think of this as the number of beds in your local hospital at any given time. A couple are already filled by patients receiving treatment for things like a car accident injury or a stroke. And this dot represents one person who's healthy and decides to go out like usual. They jump on the subway and head into the office where they catch COVID-19. But they don't feel sick right away and might not for several days. So later they go to a basketball game where they unknowingly infect 2 or 3 more people. Most of these people will have relatively mild cases, but one might be an elderly person with a severe case who will eventually have to go to the hospital. But these 3, who are all infected but don't feel sick, go out again, on the subway, into the office, and then out after work, infecting several more people, 20% of whom will need to go to the hospital. Over a short period of time, this process multiplies the number of people going to the hospital each day. Before long, the hospital is full and a crisis begins. People with severe cases of COVID-19 can't get treatment, and some who could be saved die. Plus, people with other issues can't get treatment either, and some of them die. This surge of severe cases causes avoidable deaths. That's what happened in South Korea, Iran, and Italy, all of which went from 100 to more than 5,000 cases in less than 2 weeks. A lot of people died because they couldn't get into the hospitals. This surge is made up of only severe cases, but it was generated by people who didn't feel sick, spreading the disease in public. Which means the people who can do the most to avoid these unnecessary deaths are these people. And that means all of us. To slow the virus down, you need to act as if you already have it. By avoiding public transportation, the office, crowded places, and even small social gatherings, you decrease your chances of both getting the disease and spreading it. This is called social distancing. If enough of us do it, the virus still spreads, but much slower. Over time, many people might still get infected, but fewer severe cases show up to the hospital each day, never overwhelming the system. This trend line gets flatter. These people can all get treatment, and fewer people die because of it. These are the 2 ways the COVID-19 pandemic can play out. But this one only happens if everyone does their part.
Okay, so as you can see from this video, it really underscores why it's important that we spread out the rate at which people are becoming infected and why social distancing is the solution for that. So I know I've sort of talked about this in every video, but I'm really trying to drill down why social distancing is the recommendation and why we should all be abiding by it to the best of our abilities. And it's important that we understand that when our healthcare systems are overloaded, it's not just the patients with COVID that suffer, it is everyone. It's the people who come in with heart attacks, strokes, car accidents. So it can be any of us who are greatly affected. So this idea that COVID only affects elderly people or people who have chronic illnesses, that is just absolutely not true. This pandemic will affect everyone. And with that being said, there are many cases of young people, healthy people actually dying from COVID. So we really do all have to do our part, not just so that we can protect older people and people who have chronic illnesses, but so that we can protect everyone, including ourselves, our parents, our children. So I hope this video was helpful. I will put the link down at the bottom so that you can look at this video in its entirety. But I hope that you learned something, and I will see you in the next video.